We begin tonight talking about your health. Joining us is Kuwera, Fall Recovery Navigator at the Center for Injury Prevention and Policy at the R. Adams Cowley Shock Trauma Center at the University of Maryland Medical Center. Thank you so much for joining us.
Thanks for having me.
Tell us how long you've been at Shock Trauma and what you do there.
So I've been at Shock Trauma at University of Maryland for about 8 years now. I was a physical therapist there, working in the ICU, and now I am an injury prevention coordinator and a fall recovery navigator to help prevent falls.
Let's talk about the fall recovery part. People may think shock trauma, it's all people who've been injured in serious accidents and car crashes and other, types of violence. You see a lot of orthopedic cases.
Yeah, actually falls is the #1 cause of admission at 42%. And so we see all sorts of injuries related to falls. They can be very mild to very severe. Some patients get traumatic brain injuries or concussions. Some even get hip fractures, pelvic fractures, spine fractures, and some have a mixture of those.
Young people are pretty sure that if they fall down, they're going to bounce right back up. Not always the case, and especially when you get older.
Yeah, unfortunately, there's increased risk factors as we age, such as, we might be having some medical conditions. We might be taking more medications, so having 3, 4 or more medications can cause you to have an increased risk of falls. We also may have decreased appetite and decreased sense of thirst, which can lead to poor calcium and vitamin D intake, and that can increase your risk for fractures. And even dehydration, not getting enough fluids, can be a cause for having a fall.
I imagine older people have, seen other older folks have serious difficulties after a fall, so are well aware of the risks, maybe not as aware of how to lower their personal risk.
Yeah, unfortunately, people hear stories and they think, oh, once I have a fall, that's it. I'm going to end up in a nursing home and stay there forever. But this is why we do this work, because we want people to know that falling is not a normal part of aging, that it is preventable. And there's so many things that you can do to increase your nutrition, make sure that you're talking to your doctors and your pharmacists to understand your medications and those side effects that come along with that, as well as making sure you're exercising, keeping your strength and your balance.
You mentioned that the number of medications can play a role.
Yes, unfortunately we need medications to treat different conditions that can happen, but if you're taking something like a blood pressure medication that can make you feel dizzy or lightheaded, the more medications you have, the more side effects that you will have, which can cause an increased risk of falls. The
prevention side of your work, you offer free classes. What do they consist of?
Yeah, so the free classes talk about everything that helps identify fall risk. So whether it's your nutrition, vision issues, you may have things in your home that can be helped, such as removing throw rugs, even simple things like putting all the things that you use every day in the kitchen on the counter or nearby so you're not getting up onto a chair, which can oftentimes lead to falls. Making sure that you have all the medications, your eyewear, proper shoes even. Oftentimes people wear slippers or flip-flops because it's easy to get in and out of, but having proper shoes that have a back can really support your foot and prevent falls from happening.
Hey, I've read that lighting is important. Maybe not the first thing you would think of,
yeah.
But even if somebody's vision is still 100%, just being able to see where you're going.
Absolutely, and this happens often at nighttime. We see patients that get up at nighttime because they might have to use the bathroom, and so we recommend that they either have motion sensor night lights or even a flashlight at their bedside so that they can see what's going on.
The prevention work that you do includes free classes, virtual, or you'll go to a community group.
Yeah, so we hold a class every month at Shock Trauma in person, but at the same time we do offer a virtual live stream. So people can log in to their web browser just by typing in umm.edu.com/falls class every second Wednesday of the month at 5:30 p.m.
Very good. And part of that is demonstrating some exercises, which is the reason we have these nice chairs in the studio today. Do you want to show us one or two things?
Yeah, so something simple you can do, maybe you're watching the Ravens game during a commercial break. What you can do if you have armrest is just stand up all the way and then sit down. And you can repeat this a couple times. Eventually, as you get stronger, you may be able to just kind of have your hands on your thighs or even be able to lift your arms up and come back down. This is a motion that we do every day, and it's important to strengthen your legs.
How many reps do you want somebody to do?
Really,
Depends.
a couple. Yeah, if you're doing it during commercial breaks, maybe 2 or 3 every commercial break while you're watching, a show. Is always this easy way to kind of work in this exercise.
That's great timing, except we're on public television, so no commercial breaks. But
Yeah.
if there were a commercial
Yeah.
break, let's stand up for a second
Sure.
and do the rest of the chair demo.
Yeah, and these are simple things you can build into your daily routine. So let's say you're in the kitchen and you're cooking, or maybe you're waiting for your water to boil. What you can do is just have your hand on the counter. If someone is taller, then you want to make sure you're not leaning over and it's at a good height. You want to just, for your balance, keep one foot in front of the other like this. And as you get improved balance, you can take your hands away and kind of see if you're feeling a little shaky or not. You can hold on for support. And then you would just switch the foot placement with the other foot in front. Another option would be lifting your leg up and standing on one leg. Same thing. Once you feel like you're strong enough and you have that control, you can take your hands off. And you can hold this for about 10 to 30 seconds, depending on where you are and your level. Another option to improve your hip strength is lifting your knees up and down like you're marching in place. You want to make sure your back is nice and straight, so that way you're not bending forward and using other muscles. Also, you can bring your legs out to the side. It's not a huge motion, it's just nice and slow. You'll feel that on the side of your hip. You can also bring your leg backwards, and then you should feel that in the back of your hip. And these are all muscles that we use for walking and everyday movements. So it's important to do those strengthening.
And it's important to find a chair that doesn't have wheels on it, which took
Absolutely.
us a little time here. So you want to make sure if you're doing these exercises, it's a sturdy
Yeah,
chair.
something sturdy. You can use a kitchen counter or a couch that's large and high enough, so that way it's not moving.
Anything else to demonstrate with the chair? Or
Yeah, you can. There's so many different things you can do depending on your activity level. You can come up onto your toes as well. That's a nice, easy way to strengthen the back of your legs. You can come up with your feet on top. Oftentimes, as we get older, our joints start getting stiff, so it helps with moving all of our ankles and your knees, all of those different body parts.
All right, let's go back to the original purpose of the chair and have a seat, please.
Yeah, sure.
In researching this, one thing that kept popping up, I looked at a bunch of different websites on fall prevention, was Tai Chi. Mm-hmm. Is that something you advocate?
Yeah, so a lot of the area agencies on aging throughout Maryland, all of these senior centers have Tai Chi that they offer, and it's an evidence-based program, so they've actually studied it and have found that it can reduce falls up to 30%.
I know nothing about it. It's not yoga.
It's not yoga, it's similar, it's slow movements. Some of them can be done while seated, so if someone is already fearful of falling, it's a nice safe way for them to be able to move and get that exercise in. Also, it's a nice community aspect, so you can make friends and kind of socialize, which oftentimes is helpful for those as we get older. There's oftentimes a lot of isolation that can happen because of fear of falling, and so it's important to have that aspect.
Let's hope nobody falls. But if somebody does fall somewhere and you're in a position to help with first aid, what do you do? How do you evaluate? I mean, how do you know whether this is something the person's going to be able to bounce back up in a few minutes, or we need to call for help?
Yeah, and that's something that we cover in our class. We actually tell people to make sure that they stay calm, take some rest breaks, make sure they assess the situation, they try moving their arms and legs. If they feel like they're having any pain or discomfort, to just kind of call for help and wait. Oftentimes what we have is family members or loved ones trying to help that person get up, and then they injure themselves. So we always tell patients to just wait, get comfortable until EMS can give you support.
Should this be part of a routine checkup as people get older? I'm thinking in particular about the medications. You may have a bunch of them. Individually, they may be fine, but in combination, they may cause a problem.
Yeah, and that's why it's really important, and we advocate in our class to speak up and ask questions to your providers. Oftentimes, people will have many different doctors that they're seeing, as well as talking to your pharmacist. Going to that window, having that consultation time to really understand, because sometimes there's even food that you should not be eating with certain medications. And so it's important to understand what you're taking, and if you really need to take it, how long you have to take it, if you miss a dose, really all of those things that really make you understand your body and your health.
You brought up footwear earlier, people walking around with slippers, which is totally understandable. But the importance of foot health and balance and having the right shoes.
Yeah, it's really important because we want to make sure, even if you have certain ailments like diabetes or other neurological issues, you can lose your sensation on the bottom of your feet, and that's part of our balance system. So if you don't have good footwear and that sensation, you can have an increased risk of falls. So making sure you're checking the bottom of your shoes for any sort of wear and tear to make sure that you have that grip that you need, especially when the weather is bad, like in the winter.
The people who unfortunately wind up in shock trauma after a fall, do they tend to have bone health issues? Thinking about osteoporosis, osteopenia, things that can be checked in advance.
Yeah, oftentimes, and that's why we do this class, because oftentimes these things are preventable. Making sure you're having that nutrition, getting your calcium and vitamin D, asking for an osteoporosis screen if your doctor is not already doing that. I know there's research out there that is suggesting that all women specifically should be, over 65 should be getting an osteoporosis screen.
And tell me more about the fall prevention navigator part of the job, or it's the fall recovery navigator. So we're trying to prevent it. If it happens, then where do you step in?
So we recently started a new program at Shock Trauma where I go and identify and talk to patients that have had a fall, and we kind of go through and figure out what they need. So whether it's something simple like a home modification, they need a grab bar installed in the bathtub, or a ramp placed, we can connect them with the resources they need to be able to get that placed, as well as provide follow-up phone calls to make sure that they're getting everything that they need.
Kuwera of the R. Adams Cowley Shock Trauma Center, thank you so much for joining us.
Thank you.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.